What should I be looking for in a trauma therapist?
So part of the basic training of every social worker, psychologist, and therapist is learning how to cope with trauma. But if one is looking for someone who specializes in trauma, one wants to make sure that the therapist has had experience in dealing with trauma, has experience of some of the most important modalities of treating trauma, and that's related to prolonged exposure, sometimes EMDR, cognitive processing therapy, sometimes CBT. So there are specific therapies that are geared or aimed towards dealing with trauma. And sometimes trauma is expressed in substance abuse. So then I want a therapist who has experience in dealing with trauma and substance abuse. Or very often trauma is expressed in eating disorders or in depression or in anxiety. So I want to find a therapist that also has familiarity and experience in dealing with those particular areas. And then the therapist, I want to make sure that the therapist, even though they may be experienced, that they have the opportunity also to be supervised and have gone through various extra training in that particular area. But all therapists should have that training. But perhaps I think one should emphasize the most important issue is a good fit. You want a good fit between your child and that therapist. And sometimes part of that is related to cultural sensitivity. If I'm dealing with a child who is a Gera Chassid and I bring them a secular therapist who is full of tattoos, coming from a completely different world, it might be difficult for them to connect for the child to connect to the therapist. That doesn't mean that therapist is not a good therapist and can't manage the problem. But sometimes cultural issues can enter the equation of dealing with someone in terms of communication in the beginning, especially for children who sometimes aren't able to overcome some of the nuances of differences in approaches to life, and judge things very carefully already in the beginning based on appearances, and don't have the capacity or the maturity to overcome or to get over those initial barriers. Whereas an adult sometimes can do that.